first, it was the students taking to the streets in protest over the provincial budget. Well, now, Alberta's pharmacists. They're voicing their concerns over the planned cuts to generic drug costs. 300 protesters rallied in Edmonton, 200 in Calgary, and as Terry Vogt reports, 22 pharmacies in and around Lethbridge were closed for several hours as pharmacists and employees also marched in protest.
Many southern Albertans hoping to get their prescription filled over the lunch hour were out of luck as 22 Lethbridge and area pharmacies closed their doors so the pharmacists and staff could attend a rally against provincial health care cuts.
Patient care first! Patient care first!
Pharmacists say planned generic drug rebate pricing reductions are a band-aid solution to the province's budget shortfall, one that will cut into pharmacy revenues and make it harder for Albertans to get the drugs they need.
We wouldn't be doing this if it wasn't important and if it wasn't critical to our survival and to the health of patients in Alberta.
I just heard from another store that they've had to lay off one of their pharmacists, so we're already starting to lose frontline workers.
Pharmacists say job losses and shortages of some kinds and doses of medication are the unintended consequences of the government's unilateral decision to change the funding model for pharmacies.
In fact, they've cut our revenues down to 1990 levels. And last I checked, our expenses are in 2013. Revenues in 1990, the numbers just don't add up. So it's going to cost patient care in the long run.
I know they'd like more, but we are trying to also manage costs for all Albertans and for the healthcare system.
MLA Greg Weddick says pharmacies play an important role in healthcare, and he takes their concerns very seriously. But he says the government needs to find a way to reduce drug costs.
The minister brought up yesterday in the House that there's one drug that costs 3 cents a pill in the United States, and in Alberta we pay 27 cents. You know, we've got to get that under control. It's just not fair and it's not appropriate that Albertans have to pay that much.
Instead, he says the government is looking at a fair fee schedule for services that pharmacies provide. Pharmacists say it's been more than 20 years since the provincial government made any meaningful changes to the fees paid for dispensing services. And they say cutting drug rebate revenues will make it even harder to stay in business. Terry Vogt, CTV News, Lethbridge.
Pharmacists say they're not sure what their next move is, and they say that depends on how the province responds after today.